let's be honest. If you work in healthcare, you're going to work 80 hours a week, and that entire 80 hours is going to be wiping butts. So don't do it. Just kidding. That is actually not reality. What is up, you guys? My name is Austin Marks, and welcome back to my YouTube channel. So for those of you who don't know me, I'm currently a respiratory therapist who is pursuing the physician assistant career path. So for those of you who want to follow me on my journey, or you just want to know more about respiratory therapy, make sure you like and subscribe to my page. So in healthcare, you'll typically either work 40 hours or 36 hours within a week. So I specifically do 40 hours. So I do this in a couple different ways. So I can either work 4 hours at a time, 8 hours, 10 hours, 12 hours, or even 16 hours. I will do whatever I need to make sure all my hours add up to 40. So some weeks I'll do 2 16s and an 8. Other weeks I'll do 2 8s and 2 12s. Sometimes I'll just do 5 8-hour shifts. And I mean, it all depends what I'm feeling that week or what is needed. I can also pick up overtime to get more than 40 hours. Some hospitals only allow their therapists to get 36 hours a week. So typically if they do this, you're doing 3 12s. So I don't work weekends either. What? Did he just say he doesn't work weekends? Yes, that's right. I don't work weekends because my hospital does something that's pretty significant. We have people that come in and work every single weekend. Now they're getting paid a time and a half for their weekend, and if they work any overtime, they're getting paid time and a half on that. So kudos to them because they're working weekends and I don't want to. Now, not every hospital has this. This is definitely a benefit that my hospital has, that I get to work only during the week. Now, most hospitals will either have you work every other week or every third weekend. I mean, it all depends on what your facility is and what they require. There are also other respiratory therapy jobs that don't require weekends at all, and they don't have anybody working weekends. So this will be your outpatient side, such as your PFT or pulmonary rehab. So these people typically don't work weekends or holidays. It's more of a 9 to 5 job, so they can either work 8 hours for 5 days, or they can do 10 hours in 4 days. I mean, it all depends on your facility again, and it depends on exactly what you're doing. Being on the inpatient side versus the outpatient definitely has its pros and cons. I can make a video about that if you guys want to check that out, get some more information on that. So obviously someone is not going to need a PFT at 2 o'clock in the morning. However, on the inpatient side, someone could be dying or need CPR or anything, and it's going to be crazy on the inpatient. So I talked about different hours that you could work, so 4, 8, 10, 12, or 16. So obviously, if you have 8 hours, it's going to be 3 different shifts. If you have 12 hours, it's only going to be 2 shifts. So this will typically run from like 7 to 7 or something along those lines. As a new grad, you're most likely going to get a night shift job. So this is what I got. You still get tons of experience, and you're definitely learning on the job all the time. So I covered the inpatient side, the outpatient side, all the different shifts you may work, the different amount of hours that you could work. If you guys have any other questions about anything, make sure you drop it in the comments. Hope you all enjoyed the video. Make sure you go follow me on Instagram as well, and I'll see you in the next one.